We are headed to Okoboji Wellness Clinic for another edition of Wellness Wednesday with Dr. Bradley Meyer. Dr. Meyer, good morning.
Good morning, Dave. Glad to be here.
Glad to have you along. Today you're going to talk about how bright is our light bulbs.
Yeah, exactly. So, a few months back we talked about mitochondria, which is kind of the equivalent of our light bulbs. And so that thing we call aging, every year what ends up happening is that light bulb might not be quite as bright. And especially we start to see this after the age of 35 to 40. And so that light bulb, that flashlight, it's really important for that to be bright. I look at that as the fulcrum to our health, is a bright flashlight or being a bright light, giving off lots of energy. And there's been a lot of talk lately about metabolism and how important metabolism is. Essentially, that's kind of like your light bulb and how bright your light is. And that metabolism is the mitochondria in large part. That sits inside your cell, and we inherit that from our moms, and it produces energy in the form of ATP. And we need good oxygen as a big piece of that puzzle as we produce energy. So the fulcrum goes that, every year we're losing that mitochondrial robustness. And so I remember back in the day, in the 80s, when I got a robot from my dad that had rechargeable batteries in it. And that was a big thing to get rechargeable batteries. Pretty cool. Well, we are rechargeable batteries. And so much of our health and wellness comes down to this brightness, this energy level, and recharging that battery. And so, again, when the battery starts to go down, the light dims, that's when these things can crop up. We've talked about over time all the different toxins in the environment, the things like a gluten or Wi-Fi that could bother us, or, water that's impure, and you can go on and on and on about, different toxins and inflammation, infections, things like that. If it's like, look, in the middle of the night, if your light bulb is dim, you tend to, and you don't have the lights to turn on to go to the bathroom, you bump into things. Mm-hmm. And so with that bright light on, we're able to navigate the world of all those exposures to things that challenge us a lot better. We can avoid them. We can fight them off. And eventually, if we don't avoid those things, they turn into disease. And so, Dave, I always like to say, what's the best treatment of any disease? It's don't get it. And so that gets into the prevention side of thing. But if we do get it, and the diseases where the organ system might not be working as well, then we need to start to look at metabolism and how do we recharge that battery again. That comes down in some of the biggest energy burners in our body: brain, heart, liver, kidney. Those are the 4 biggest energy suckers, burners, and so those can be the weak link in the chain. If somebody is not getting enough energy in those areas, then those systems start to not work as well. So we got to bolster the energy, specifically in those. You'll see it in those energy burning areas. So that's why some folks with memory problems, at the end of the day, they get low on energy, and they call it sundowning, but essentially their brain has run out of gas. It's run out of energy.
Mm-hmm.
And so how do we get to the recharging and figuring out, okay, what do we want? We want to essentially recharge the batteries, fix that metabolism. And so we need to take a really good history, and that takes sometimes an hour and a half. And a friend of mine, Dr. Schallenberger, that I did some work with this fall down in Nevada, he's an incredible integrative physician. And he shared a story about a doctor in medical school, Dr. Teddy Woodward, and he helped discover rickettsial diseases. The guy kind of walked on water, as what Dr. Schallenberger shared during medical school. And a couple sage things of advice when we talk about getting to where we want to go to fix that metabolism so we don't develop disease or that we lessen the side effects of it. He said, for goodness sakes, listen to your patients. Just shut up. And they're going to tell you what's wrong half the time and how to treat it. And so a lot of times we as doctors can get this propensity to talk too much. So it's listening. So that's a big piece. The second piece then is to determine, try to figure out, okay, what are the factors that are decreasing that metabolism? And again, it could be nutritional deficiencies. It could be your hormones. It could be you're having too many carbohydrates. You might be high at trans fats, hydrogenated oils that are going to inflame your system. You might have some stress going on in your life. It might be related to genetics. It might be blood flow. It might be medications you're on. So that's the process of determining where to go to get that metabolism boosted. Is saying, okay, what are the factors that are decreasing that metabolism? Where is the weak link? And then those folks that end up getting well, and we've worked with a lot of folks here over the course of the last 3 to 4 years. When they're getting well, what is it that's happened? We've essentially fixed their metabolism. And a big part of what we do is, okay, how are we going to bolster the metabolism? How are we going to recharge those batteries? And many times it's a big commitment lifestyle-wise. It can be, being on the right supplements, doing some ozone therapy, which we've got up and running in the clinic now, and red light or hyperbarics. You get these in combination with getting those toxins or those things that are factors for decreasing metabolism, get those fixed, and that battery is going to recharge. And so what we want to do is we want to use the tools that are going to make you better. And so we like to, we always talk, Dave, about the broad tool belt, to have lots of tools and options. And how, yes, we like to do a lot with holistic approaches, but sometimes the tool might be still a traditional, quote unquote, medication or pharmaceutical. Mm-hmm. That being said, the same Dr. Teddy Woodward said, and I just stuck with me, he told Dr. Schallenberger that if you're on over 2 drugs, if you've got your patients, your guests on over 2 drugs, you are a bad doctor.
Wow.
And so, and I don't think most doctors, myself included, over the years, want to necessarily be throwing tons and tons of medications on folks. That's a 7-minute visit typically in the system, and a lot of the training in medical school focused on pharmaceuticals and that tool. And so a lot of these holistic tools used to be part of the medical genre, the medical training way back when in the 20s, 30s, 40s. And so that's where you're seeing that piece coming back in, again, what we have here, but it's what do we got to take, from any side. We want the benefit to outweigh the risk and put those together so we can get the battery charged up, so we can brighten your flashlight, brighten your light, and bolster your energy.
Pretty incredible when you think about it, especially those 4 main areas that you talked about, beginning with the brain. And you're right, sometimes I can tell it in my eyes, honestly. This seems weird. You get to the end of the day and my eyesight is not as good as it was first thing in the morning. My eyes are tired. And it's incredible that you bring that up. So folks that want to come see you, want to come visit with you on how to get their light bulb brighter so it's not fading, how do they do that?
Mm-hmm. Okay, yeah, come visit us at 3305 Berquist Avenue in Spirit Lake, just off Highway 71, 712-339-6024. If we want to do a discovery call, those things are real popular right now, and that's where it's a complimentary visit to just briefly look at your history and say, how can we plug in and get that light bulb brighter again, get that metabolism back line again, 712-339-6024.
And especially as we're just in the middle of January here, you want to get this year off to a good start and get to feeling better. Be a good way to invest in your health.
Absolutely. Again, like we said, the best treatment of any disease is don't get it. And we want to prevent so that we have that quality as we get older to do the things that are all the top item lists on our. The one guy that just real quick that came in earlier this week, he said his why. He's retired now. He's like, to spoil my grandkids and to live longer so I can spoil my grandkids longer. Oh. So that was his why to do. Hey, I want to get this metabolism in order.
That's awesome. That's cool. Well, Dr. Meyer, always a pleasure. Have a great day. We'll chat again soon.
Great, Dave. Take care. Be well, everybody.
Thank you very much, Dr. Bradley Meyer at the Okoboji Wellness Clinic. You can find out more online as well, okobojiwellnessclinic.com.